You mentioned that friendships, the friends that our children have, is a predisposition or a risk factor for
Hmm.
addiction. Let's start there and also look at what are the other risk factors
Hmm.
for addiction in children and teens.
So the big ones, so genetics is, there's a really, there's an analogy that I dislike but works really well, which is that genetics are the bullet in the gun and trauma is the trigger. And
Mhm.
really that actually is quite apt. I hate the analogy, but it is quite apt in that, genetics looks to be about 50 to 60% of the picture. And then what happens is a lot of people can have this, this genetic predisposition, but then the environment that they grow up in and the things they're exposed to, whether that's violence in the home, substance abuse in the home, death of a family member, a whole bunch of different experiences that are called adverse childhood experiences. There's a wonderful book called The Deepest Well by Nadine Burke Harris that I highly recommend if you're curious about those.
Yes.
And the higher the number of these experiences that you've had, the higher your risk for lots of different negative outcomes, not just substance abuse, but mental health disorders, heart attack, stroke, all kinds
Mhm.
of things. So if we can understand that big picture, and then on top of the genetics and what's called epigenetics, which is the way our genes sort of express themselves based on the experiences we have as kids, um, and then the trauma, there's also things like academic failure, social ostracism,
Mhm.
aggression towards other children. All of these things are risk factors for substance abuse. And it's really important that we get there early and we assess these kids early and intervene early so that we can deal with those risk factors early on when they're first happening so that kids don't have to come up with, you know, alternative ways to deal with their feelings, like numbing them out or escaping from them. We have to help kids deal with that stuff early on so that they don't have to go self-medicate later on with drugs and alcohol.
Yeah, so the early the adverse childhood experiences,
Mm-hmm.
as you said, is a very
Mm-hmm.
important risk factor. Based on the research that you had to do for the book, what is the age that children usually start to experiment with substances, and which substances are they more likely to experiment with?
So, if you talk to people who have a problem with substance abuse in their adult life, 90% of them report that they started using drugs and alcohol before age 18. But I think it's really important for us to realize that of kids that will begin using substances, middle school, which in the US means kids between like 11 and 13, 11 and 14, that's the age at which, if kids are going to start, that they start. So the numbers go up as they get older, but middle school, that sort of, tween, teen, early
Mhm.
teen area is really where we need to be. We need to have education programs in place before that, really really effective substance abuse prevention programs in place before then. Because
Right.
if we're waiting until that age comes along, thinking that we're safe until then, we really haven't laid the foundation. So that's why the book covers the new book, The Addiction Inoculation, covers from little kids all the way up through sending them off to college and
Mhm.
beyond, because that education starts really young. And clearly we're not telling preschoolers about crack cocaine and things like that. What we're
Yeah.
talking about with preschoolers are general health behaviors about what we put in our body and chemicals, and little things like why we don't swallow the toothpaste, why we spit the toothpaste out, that kind of stuff. And those conversations, if they start really young, the other benefit is they get easier and easier to have because it
Mhm.
becomes normalized in your household. And in terms of the drugs that, there's this thing called a gateway hypothesis that has sort of been debunked largely, but there really is a pattern that kids tend to follow. And that's,
Mhm.
going from nicotine, vaping to traditional cigarettes, beer
Mhm.
and wine as sort of an entry level drinking, marijuana after that. There is a trajectory that some kids tend to follow, but it doesn't follow not every kid is exactly the same. There are differences within socioeconomic groups, and there are differences within race. And so I think it's important to remember that um, I think it's really important that we start all the way back pre, nicotine, vaping, cigarette
Right.
use, because those things do tend to predict future use, not necessarily do. And also I want parents to remember that generally speaking, kids can try drugs and alcohol and not necessarily become addicted. In fact, the vast majority of kids don't. It's about
Right.
10% of us that have
Mhm.
just the way we're wired, the way our brains work, the way we're set up chemically. Um, I can't drink. I can't have one drink because I don't know what'll happen after that.
Right.
But, for the other 90% of the population out there, we're not necessarily talking about substance abuse disorder developing. What I'm concerned with is that adolescent brains are acutely sensitive to the substances we put in our body that affects the receptors in the brain and that affects the chemicals in the brain. So I think it's important to remember that, yes, we're talking about the potential for substance abuse, but we're also really talking about protecting the adolescent brain from damage.
Yes, and before we get into why the teenage brain, is so
Mhm.
susceptible to addiction, have you found out some of the reasons? So we have the environmental
Mhm.
issues relating to abuse and home environment and so on as risk factors. Have you found out why children initially experiment with the
Mhm.
cigarettes and the alcohol? Is it only to impress friends? What's going on there?
It really depends on the kid. I mean, we can make some generalizations. The big generalizations are that from about puberty until the early 20s, that period of adolescence, adolescents really do, for very, very good, solid, valid reasons, seek out novelty, seek out risk, seek out, the approval of other kids. And all of that is really important because what the purpose of adolescence is to help kids individuate, help kids become their own people, so that when they become adults, they are their own individual people and not just extensions of their parents. So kids should be seeking out novelty, seeking out new things, seeking out thrilling new experiences. And the other thing that is important to keep in mind is that adolescents have lower baseline levels of this thing called dopamine, which is really all about human motivation. I mean, dopamine is at the center of what we call drive or human motivation. And
Mhm.
adolescents have lower levels than young children or adults. And so when our kids complain about just being bored or everything feeling kind of monotonous, that's what they're feeling. It's real. It's not a made up thing that they're just sort of complaining about. And so in order to make life feel more exciting, you have to seek out these novel experiences and a little bit
Right.
of risk. So it's our job as, teachers and parents and mentors and coaches to help kids seek out positive risk, to help kids seek out opportunities to get a shot of dopamine, to get a little hit of, those good hormones, those good neurotransmitters in the brain that make them feel engaged and excited, without it necessarily being because they're seeking out a substance to either numb out or to
Mhm.
alter their perception.